Most people understand the importance of having safe, secure, and affordable housing. They know that it offers them protection, security, and stability, but few recognize the importance of housing in determining their level of health. First of all, housing is linked with educational and economic status, the two biggest determinants of health. More directly, housing is linked with mental health, nutrition, asthma, infectious diseases, domestic violence, chronic diseases, environmental toxins, healthy aging, access to health care, to name just a few of the health issues. Despite the fact that housing is a major determinant of health, too many people lack safe, stable, and affordable housing. That's why we're going to focus on the link between housing and health on today's episode of A Public Health Journal. Please stay tuned.
Welcome to A Public Health Journal, a program that explores public health issues facing our society today and tomorrow. The host of the show is Dr. Ed Ehlinger, Commissioner of Health for the state of Minnesota. A Public Health Journal is sponsored by the Minnesota Department of Health and the Hennepin County Human Services and Public Health Department, all working together towards the goal of healthy people living in healthy communities.
Welcome to A Public Health Journal. Today we're going to discuss the link between housing and health. Those who are fortunate enough to have safe, secure, and stable housing often take for granted the benefits of their housing. But those with unstable housing live with the daily reality of how lack of stable housing negatively affects every aspect of their life, particularly their health. However, for almost everyone, the cost of housing is a major concern. Even the people who currently have housing are often only a few lost paychecks away from having their housing being unaffordable. That's why safe, secure, and affordable housing should be an issue of concern for all of us. Joining us today to talk about housing, and in particular its link to health, is Mary Tingerthal, Commissioner of Minnesota Housing, which works across the affordable housing continuum, from helping to prevent and end homelessness, to financing affordable rental apartments, to helping Minnesotans buy and fix up their homes. Ms. Tingerthal also serves as the chair of Minnesota's Olmsted Subcabinet and co-chair of the Minnesota Interagency Council on Homelessness. Mary, welcome to the program.
Thank you, Ed.
Before we get into some of the specifics related to housing and health, tell us a little bit about the Minnesota Housing Finance Agency. When did it get started and why did it get started?
Ed, our agency is almost 40 years old now, and it was started when the federal government allowed state agencies to sell tax-exempt bonds to finance housing for first-time homebuyers. And Minnesota was at the front of the pack in forming a housing finance agency, and we've been going strong ever since. And we provide a spectrum of financing. One of our hallmarks is bringing first-time homebuyers into homeownership, but we also provide millions of dollars each year in rental assistance for very low-income people, and also provide capital to build new rental apartments that are affordable.
Okay. So why 40 years ago did the agency get started? What was the need at the time?
It's interesting. I just recently ran across a speech that was given at the state legislature by one of my predecessors, Jim Solom, who ran the agency for a number of years. He worked at the state planning agency then, and working with Governor Wendell Anderson, he presented a picture that looks very much like it is today, that affordability was very, very tough for people to be able to, of modest incomes, to be able to buy a house and really establish themselves in a good neighborhood. And I was really struck by the parallel of the numbers then and now. Unfortunately, we are seeing it trending in the wrong direction now, and we're working even harder to keep pace.
Mm-hmm. And how did you get interested in housing and the financing of housing?
Well, that's a great question, Ed. When I graduated from college in the mid-'70s, I had a job as a community organizer, and I worked in a neighborhood in St. Paul that I grew up in that had very, very tough housing conditions. And so as a community organizer, housing was my number one issue. And so I worked with the community council there. And as part of that, there was a bill in the legislature that was going to provide money for Minnesota Housing to be able to establish a home improvement program. And I went and worked with legislators at the state capitol for the passage of that bill. Much to my surprise, 2 years later, there was a job at the Minnesota Housing Finance Agency. I worked there for 10 years. then left for about 25 years and was delighted to come back after spending that 25 years, mostly in residential finance, to come back and lead the agency where I started.
Well, I'm real pleased to have you as a colleague on Dayton's cabinet working on some of these issues. So we're going to talk about the link between health and housing, but I want to first talk about the numbers related to housing, because you mentioned in the 70s they were sort of similar to what they are now. What's sort of the status of housing in Minnesota right now in terms of security, stability, rental, homelessness? What are you seeing?
So and we talk about two main numbers when we talk about the need for affordable housing. The first one we talk about is the number of people in Minnesota that are paying too much for housing. And for a long time, that definition of too much is when a family spends more than 30% of their income for housing. And today, there are 600,000 households in Minnesota that pay more than 30% of their incomes for housing. That's both rental and home ownership. I know that number surprises a lot of people, and that's particularly acute if your incomes are lower. The percentage for renters is much higher than that, so we really do have a crisis. Related to that is the fact that since 2000, we have seen incomes in Minnesota be fairly stagnant, and in fact the purchasing power of people's incomes has actually declined if you adjust for inflation, while rents have gone up. So we have seen incomes decline by about 5%, and rents and housing costs increase by about 12%. So that gap, unfortunately, is just getting bigger. The second thing we talk about is real housing instability, and that's the number of homeless people that we have in Minnesota. And today, based on a count done in January of this year, that number stands at about 7,300 individuals throughout the state. And that truly is at the core of where housing really can have a devastating impact on health.
All right, I want to get into then that link between housing and health, given those numbers. But first, we're going to take a little break, and we're going to see a little video from your agency, and then we'll come back and talk about that as it leads into some of our other discussions. So we'll be back right after this video and this message.
My name is Alicia. I'm a proud new homeowner. Homeownership in one sentence means stability, security, and strength.
With first-time home buyers, it's not just about getting a mortgage to buy a house. There's so much more responsibility to being a homeowner. So at Minnesota Housing, we really emphasize the importance of homebuyer education before you buy that first home.
I recognized that being a homeowner was going to be an investment back in myself and in my family.
Homeownership capacity is a great stepping stone for participants because it allows them to come in and meet with somebody that's not going to give them a loan. It's going to get them ready for homeownership, and I think that's the key to being successful is actually meeting with somebody that doesn't have any strings attached. So we're not getting paid commissions if they buy a house. We're not getting paid commissions if they don't buy a house. We're getting paid to educate them on how they become a successful homeowner. So I think the need is really there, and the way the program is set up allows them to take their time and go at their own pace to get ready for homeownership. There's no pressure on them at all.
When I looked at what I knew my barriers were, which was out of control spending, lack of a budget, which is a guide, and learning new healthy behaviors to understanding and using credit. Those were the three barriers. Kelly helped me address each and every one of those.
I think when we first met, there was some uncertainty, nervousness, anxiety about becoming a homeowner, and being afforded the ability to build a long-term relationship because of Minnesota Housing Support has allowed me as a counselor and her as my client for us really to come together with this goal. Her goal of homeownership was for her, but with me being able to support her fully and integratively with financial counseling and home purchase counseling allowed that to be a very healthy and fruitful relationship for both of us.
Keely, she met me with no preconceived ideas or judgments. It made it very easy to be transparent and talk about those learning mistakes I had made in the past. And we actually started working and building a professional relationship that was geared toward one goal, and that was home ownership. So it was a long-term investment, but as you can see, I'm sitting in my home now, and it was well worth it.
Welcome back. We're talking with Mary Tingerthal, Commissioner of the Minnesota Housing Finance Agency. Mary, it's obvious from that video that this woman is just tickled pink to be in a housing. You could tell she's happy and secure and looks healthy. Tell us why it's so important from a health standpoint to have stable and secure housing.
Ed, there are so many things that depend on having a stable place to live. First of all, just general well-being. If you don't know that you can pay your rent at the end of the month, or even worse, if you think you might be evicted, the level of stress and anxiety can really take a horrendous toll, not only on the parent and the family, but especially on any kids in that family. And so we know that by providing opportunities for affordable housing, that's housing where you're not paying more than 30% of your income, either for a mortgage payment or for rent, really allows you to have that peace of mind. So that's a big piece of it. But we also know that if kids are moving from place to place because their parents aren't able to pay the rent and they need to move to a less expensive apartment or a worse neighborhood, that has an impact on education as well. And we know, for example, that kids who've experienced only one episode of homelessness have test scores when they get to the third grade that are dramatically lower than any of the other kids in their, even their same income group.
Well, it's interesting that you mentioned the very first two things, income, or the wealth, the disposable income that you have, and education, the two greatest determinants of health. As we know, as your income rises, your health gets better, as your educational level rises. And housing is related to both of those, isn't it?
It is, indeed. And Alicia in the film talked about the fact that credit counseling came first before the home buying counseling. And we think that's so important because home ownership without that good, solid base of credit counseling really can be pretty precarious. So we think it's important for potential home buyers to first understand getting their credit life in order. And some of the people who go through those courses end up not buying a house, but what happens is they're in a better position to rent more effectively. And we think it's a win-win no matter which choice they make.
Right, and you can tell she would seem relaxed, and you talked about stress being one of those things. So my guess is that there's some real link between housing and mental health issues and domestic violence and the violence in communities. Is there that link that you see with stable housing, that it reduces those mental health problems?
Absolutely. We, in our rental housing, work a lot with the counties and with social service providers who are serving people who are actually diagnosed with a mental illness. And what we find is that oftentimes it's difficult for people with a mental illness to actually rent housing in the community, even if they are surrounded by the services that will allow them to be successful. And what we know is that when a person with a mental illness gets into a safe, stable home where people understand their mental illness, they can really thrive. One of the things particularly about mental illness is the importance of medications and taking them on a regular regimen. If you're bouncing from house to house, even experiencing homelessness in between, keeping to that regimen is almost impossible. So we've seen some dramatic improvements of people not showing up in crisis, showing up in emergency rooms, when we can get them into stable, affordable housing.
There's another factor related to that is as people get older, my guess is they have less disposable income. Is housing insecurity an issue for the aging?
Ed, we're really beginning to see as us baby boomers begin to move through our age spectrum that there are an increasing number of seniors who will have very limited incomes in retirement and also who really have not accumulated very much wealth. And so we see seniors that are really struggling with keeping the homes they live in a way that they can continue to live there. We know that a stable home where you're not worried about whether you can pay a mortgage or that is accessible to you if you happen to need some assistance with mobility. All of those things are more of a challenge as we have more people aging without a lot of income.
And in that whole area of stress and security, are you concerned about housing and neighborhoods? I mean, neighborhoods really make a difference to people's lives. And when you get people into housing, are you concerned about actually improving the neighborhood, making sure that there's safety and security in the neighborhood in addition to safe and secure housing?
And there are lots of opinions about how a state agency or a local agency should work with communities, but our goal has always been to have people have affordable housing in a community of their choice. And so what that means is that we finance housing in all different kinds of communities. We try to work with those communities that may have some more challenges with, for example, removing vacant homes, working with City of Minneapolis and St. Paul, for example, and replacing them with new energy efficient homes in many cases. We also try to address the fact that there are some families who really would thrive better if they lived in a more suburban community. And so we finance housing in what we call areas of opportunity, and that includes things, first of all, affordability, but good schools, access to transit, and really healthy living conditions.
Great. And I want to talk specifically about some of the programs that you have and the activities you do, but I first want to kind of finish ending up looking at that video that we started with about being a home buyer. So let's look at this piece of video and then we'll be back.
Great.
The success has been great. We've had a lot of people come in that didn't even think they could be homeowners, that didn't realize that one or two things stopping them from becoming a homeowner was just maybe $400 or $500 away, and once they took care of that, they were able to become successful homeowners. The Homeownership Capacity Program has taken off like wildfire.
In Alicia's case, the skills that she's learned and the lessons she's taught for her family will have ripple effects. And continued funding and continued financial support from the state of Minnesota is critical to continue to let that happen.
It's just been so exciting for me coming to the Minnesota Housing Finance Agency after the mortgage crisis and being able to see it turn around as interest rates are at historic lows, to be able to bring that dream of homeownership to so many families and to really turn to those communities who are newer to Minnesota, maybe immigrants, maybe people from other parts of the country, to really say to them, homeownership is a dream that you can achieve.
So when I talk about what my mortgage payment is now compared to what I've paid in rent, I actually want you to sit down. You won't believe this. My mortgage payment is $1,150.11. I have never paid a rent that low before. That's money I don't have to give out anymore. That's going towards my investment in myself and in my family. Being a homeowner is the best decision I've ever made.
Welcome back. We're talking about housing in Minnesota with Mary Tingerthal from the Minnesota Housing Finance Agency. Mary, I love seeing that video, and I want to talk about, in my initial introduction of you, we talked about the fact that you deal with homelessness and rental and home purchasing. Let's start with that end of the spectrum that we saw here, home buyer. What does the Minnesota Housing Finance Agency do to really help people get into housing, to buy a home, to get their mortgage and move forward?
Well, first of all, Ed, we have committed ourselves to helping to close what we call the homeownership disparity gap. If you're a white homeowner and if you're a white person in Minnesota, you have a 76% chance of being a home buyer. If you're a person of color, that drops to 40%. And we think it's time for our households of color to really share that same stability that homeownership can bring in a state like Minnesota, where homeownership really is affordable and where it provides a lot of stability. So we have really focused, especially in the last couple of years, in reaching out to communities of color, and as we saw in the film, really showing families where maybe a first-generation owner, that home ownership is a possibility for them. It takes hard work to get those budgets in line and to understand what the responsibilities of homeownership are, but it's definitely accessible. Once you're ready for that home buying, we also provide deferred loans for down payment and closing cost assistance to help those home buyers compete in a marketplace that right now is very, very competitive. And it takes advantage of the fact that we're able to offer mortgages with very low interest rates for an extended period of time. So all three things are really important.
Yeah, and I know that this disparity in home ownership didn't happen by accident. There were many policies that actually discriminated against populations of color. Are you working on those discriminatory practices? Are those things of the past, or are those things that we still have to work at?
Ed, we definitely are, and we have just a terrific crew in our homeownership group. 3 individuals who go out and work with realtors and home mortgage lenders that actually originate our loans, and really work with them to understand that when they see a qualified buyer across the table, they should not be looking at their race or really thinking about that at all, but really looking at the qualifications of that borrower in a colorblind sort of way. But we also are working with trusted people in these cultural and ethnic communities, because oftentimes there are scary stories about people being lured into home ownership that got them in trouble. And so we really work to build relationships with community leaders, whether it's in the Somali community or the Hispanic community throughout the state of Minnesota, to show them how powerful it can be to bring the idea of homeownership to people in their community.
Good. What about the rental area? You do a lot of work with rental. What kind of programs do you have there?
We have a variety of programs, Ed. One of the things we focus on is permanent supportive housing for people who have experienced homelessness for some reason, and really to be successful going forward, they really require not only housing, but access to services. And we've had a tremendous partnership for more than 10 years with the Department of Human Services, where we bring together social service providers with the people who own and manage rental housing. And I think people would be surprised that they actually have people who may have experienced homelessness living right in their neighborhood, living right in their building, because we integrate it rather seamlessly. Another thing that we make sure that we do is, back in the 70s and 80s, the federal government provided a lot of capital for housing, something they don't do so much now. And we have about 100,000 units in Minnesota that have some sort of rental assistance attached to them. And as long as we keep those buildings in good repair, those federal dollars will continue and really make deeply affordable housing. So we have a priority for repairing and making capital investments in those buildings so that they remain as good places for people to live. Finally, I would say we've had a focus, especially the last few years, in workforce housing, particularly in greater Minnesota. where some communities have a 0% vacancy rate.
Yeah. Well, I know the third area is homelessness, and we're running out of time. So actually what I need to do is have you come back, since you're the chair of the intercouncil, the focus on ending homelessness, really develop a program just to that, because that's a huge issue that I think we're making some progress on. So Mary, this has been really, really helpful. Thank you very much. Thanks for the work that you do. Thanks for being a good colleague, and we'll move forward together on getting safe and stable housing for everybody.
Thank you, Ed.
And I'll be back with a closing comment right after this message.
They'll test you, try to break your will. But however loud the loudness gets, however many cheese puffs may fly, you're the driver, the one in control. Stand firm. Just wait. And move only when you hear the click that says they're buckled in for the drive. Never give up till they buckle up.
The Institute of Medicine has defined public health as what we, as a society, do collectively to assure the conditions in which people can be healthy. This definition says nothing about doctors or nurses or sanitarians or nutritionists. It doesn't even say anything about hospitals or clinics or health departments. It talks about what we do collectively. That means that public health is not a place of employment. Rather, it is a point of view, a philosophy that you bring to your work, whatever you do. Further, the definition doesn't say anything about disease or illness or injury. It talks about the conditions needed to be healthy. And as we learn more about what conditions actually impact health, we find that a lot of partners are needed in our collective efforts to foster good health for everyone. We need partners in the fields of transportation, energy, education, insurance, business, agriculture, city planning, architecture, climatology, and many, many more. And as we've heard today, we need partners who can help everyone gain access to safe, secure, and affordable housing, one of the greatest conditions with the greatest impact on health. Health impacts all aspects of our daily lives, and every aspect of our society affects health. There are health implications in all policies. There are health outcomes that are affected by all systems. There are health effects in all programs. There is health in all activities. That's why we need all of you to be part of the public health team. That's all for today. Thanks for watching. I hope you can join us again next time on A Public Health Journal.